Okay.
I've had to come off the headset wasn't giving me anything.
Okay. So is this fine now? I'm audible, right?
You are very audible.
Okay. How are you doing, sir?
I'm good. How are you?
I'm good too, sir. I'm Dr. Anishma, if you recall from the session we had earlier, one of the assistant professors.
Lovely.
So we'll just wait for a few more minutes. I think a few people are logging in, and we'll just start off in a minute or so. Is that fine?
Yeah, that's good.
Yeah.
Do you need me to be ready to share?
Yeah. Yeah, you can share actually. So, are you not able to?
How's that?
Yeah. It's just loading.
Have I lost you?
No, I can hear you, but your screen has not yet been shared. Yeah, now I can see. We can see the screen, sir. It says Project Physio. Is that it?
Yeah, that's good.
Yeah.
That's good. What would be even better would be.
Yeah.
Can you see a screen in a screen, or do you just see the big Project Physio?
I just see the big project. No, actually, there's a small screen. No, that's the cursor that you are pointing at, right?
Yeah. So if I go there, how's that?
Yeah, I can see only the presentation now.
Only a presentation. So if I go there, then you should see.
Yeah, I can see the whole thing. Yes, sir.
That's perfect. Okay, good. So I've got presenter view on fine and you're on fine, so we're good.
Yeah, we'll just start in, I think, a minute. Okay, so we'll start, right?
Sure.
Yeah. So good evening to one and all. I welcome you all to the webinar. The lead physio for the men's senior team, Mr. Stephen Mutch, is the speaker for today's webinar. I welcome you, sir. A little about sir is that he's, as I said, the lead physio at the men's senior team at Ireland Rugby Football Union. Until the summer of 2020, he was the head of performance at Montpellier Rugby and a clinical director at a private practice in Edinburgh. Stephen sir is actively involved into research of decision making and is in return to sport, that is RTS. And I would also pleasantly and very excitedly say he's one of our dearest board members who we have on our side in our journey for the GITAM School of Physiotherapy. So I welcome you once again, sir. You have taken out your precious time to address to our audience regarding role of physios in sports. So I'm sure they'll be enlightened as to what the physio plays a evident role in bringing back the sportsmen to their routine once they have faced any injury or in just keeping up the maintenance of their sport, right, sir? So over to you, sir, and we can start with the presentation.
Thank you very much for inviting me in this first week. What a fantastic honor it is to be able to speak. I hope you'll be able to get my accent. It is Scottish. I am a physio, however, working over in Dublin in Ireland. And it's great to be with you today. The role of the physio in sports is actually such a broad topic. So I'm hopeful that you will be able to get something from the excitement of being a physio primarily, and with an interest in being involved potentially in physio and sport in future. My background was fairly well documented there. A lot in terms of player welfare with the Irish Rugby Union now, and I help oversee the delivery of a robustness program, and we'll talk a little bit around a robustness and injury. We're looking to try and drive best practice, and that's part of my role. We look at the injury management overall, and that's part of my position here in Ireland, and looking after player welfare and particularly longer term player rehab. So I have a role where I look at projects of relevance to the international squad, men's and women's, and also horizon scanning, which we'll touch on, which allows me to look into the best practice going on anywhere in the world. I thought I'd put in some elements of my KPIs here around national, provincial staff. So we have a number of teams who operate professionally, and I work with them to try and ensure that we have a good trust between us all, and we respect each other's work, so that ultimately we can have the best situation for our national team players going forwards. I have to communicate appropriate information and attend certain meetings with coaches, but also with medical directors and with hospitals. And I, as I've said, monitor medical processes used by our team, but also the delivery of the players to us from the national provinces. Previously, I was with Montpellier Rugby in France. I had a couple of years working there. And I'm also a clinical director of an online business, which also performs face-to-face in central Scotland still. I graduated. My journey began 30 years ago in Glasgow, and I graduated with a Bachelor of Science in Physiotherapy. And in 2008, I obtained a Master of Science in Sports Physiotherapy from the University College London. I've worked in the northwest of England as well as Auckland and New Zealand. I've worked in professional sports since 1998. I have some multi-sports experience with Scotland in particular in Commonwealth Games, and I've been to India on 2 occasions for the Youth Games and Commonwealth Games. And I've also been with Team GB for the Youth Olympics in Buenos Aires, and also with GB students at several World University Games, including being head of the medical services for Team GB students in 2019. And I have some additional interests which some of you maybe find interesting. I'm actively involved in research around shared decision making, and we look at counterfactual thinking and regret. Particularly, both of these affect return to sport. So when players are injured, when athletes are injured, part of our role is to try and assist with the physical, but also not just the biological changes that take place after injury, the cascade of inflammatory response. We also want to look after the psychological and the well-being nature of an athlete when they undergo injury and are returning into sports. I was co-author on the consensus paper on return to sport in 2016, and I've also written some content for return to play as well as fascia sport and movement. I spoke last month in Greece on at FIMS, which is a global conference, and again I'll be speaking on prevention of injury, where I'll host a workshop at the IOC in Monaco at the end of November. Academia is an opportunity for us to share what happens in the applied sciences. So when I'm working, I want to try and use the best practice possible, but I also want to share what we do. Okay. So how can we achieve the vision of imparting global standards within education for you all? And part of this is that our rationale is that we are going to be patient-centered, and physios have to be patient-centered, person-centered. It has to be appropriate to the settings and roles, and for me, that is obviously sport, and that's some of the knowledge I'll be imparting today. We have to look at broad initiatives so that we can widen access, participation, and encourage people to come out of any degree here with a program that allows them to obtain work. The profession is a degree sport-based healthcare profession. And that's really important. What I've done here is I've put in bold some key areas that are really important for sport as well as for physiotherapy. So although physiotherapy works with people to identify and maximize their ability to move and function, that's super important for us in sport. We use a range of interventions, and physiotherapy is a science-based profession looking at the whole person. And I hopefully have already started nudging you towards thinking about the whole person in health and well-being and lifestyle. Again, what I've done is condense some of the material based around what's important for a physiotherapist, but also then try to put in some bold comments there about what's important from sport. And this is where the essential part of being healthy is important, as physiotherapy helps the injured. It aids sporting performance, and it can maintain health for people of all ages. So we can encourage athletes to return, manage pain, and prevent disease. It's really important as physiotherapists who are involved in care that we help with education, awareness, empowerment, and enabling, and that we encourage people to participate in their own treatment and rehabilitation. There's some values that are really important that, again, I think are holding good in sport as well as within physiotherapy. We have to be accountable for the decisions that we make and for the actions we take. We have a commitment to excellence. You do have to be compassionate and caring in sports. We have to demonstrate strong leadership behaviors, show good knowledge, theoretical and applied, and we have to demonstrate good skills. We have to learn new skills and apply them. We have to enjoy motivating others. Motivation is really important, whether it's intrinsic motivation from within the athlete, we have to encourage that, or whether it's extrinsic from other factors. But we have to enable athletes to participate in improving health, well-being, and quality of life, even when they're injured with long-term injury. Some of the knee injuries we may see can last 9 months before they return to the field of play. With traumatic brain injury, it's unknown as to how long it might take for athletes to return. So it's super important that when we're dealing with using our knowledge and skills in neuromusculoskeletal medicine, that we're able to assist the psychological as well as the bio. And this is what gives us the biopsychosocial model. And I've described how we work across a variety of specialisms in health and social care. And again, I've put in bold key areas for the sports physio. Research, really important, and how we apply it. Education, important not just for our own personal education, but how we impart knowledge to the athlete and also to those who are around us. We have to work in an interdisciplinary team, so it's important we recognize the other strengths of members of the team and that we're able to bring our own strengths to bear around a table when discussing athletes. We also can be consultants within musculoskeletal services such as private practice, and we may well see some athletes who have been involved in recreational or weekend sports. So overall, there are exciting opportunities within sport and prevention of injury, whether it's through tele-rehab, remote monitoring, or autonomous practice. It's super important that we consider how injuries occur. If we now look at how the faculty is going to help you in your journey, we're going to be looking at helping others learn and develop. That's super important for me. I'm very passionate about that. We want to help you as an individual, but also as you work in groups. And we want the faculty to try and create the activities and opportunities so that you have the best opportunity for learning and development. Really looking at what's happening globally and taking some of that to help you guys locally. So we're looking at designing materials to facilitate learning, development, offering new opportunities and experiences, and then reflection, which is super important for a physio, but in a sports world, reflection has to take place on almost a daily basis. So we have to look at practice decision-making. How do we practice decision-making? How do we do that reflection? It's all about the context. And today we're talking essentially around the sporting context. It's a very different environment to many of the other contexts that we will see through the physiotherapy journey that you undertake. Decision-making, though, is important in all of those. Decision-making is around the behavior, knowledge, and skills that you employ and you bring with you on any given day. So you collect your information, you process and you analyze it. And then from there, you draw reasoned conclusions, you make informed judgments, and we look to address the issues or resolve problems. And ultimately, it's very cyclical. So in that instance, we have to evaluate our own processes as well. We have to look at our own mission, and we have to look at how are we interacting, the relationships with other people, and what also are we understanding of the situation that's going on. I thought we'd have a look a little bit at decision-making in practice. Again, look at the process of analysis, evaluate the best available evidence. We want to integrate it with our own individual expertise and also the needs and preferences of those around us. We have to use evidence to lead best practice. And that, therefore, the behaviors, knowledge, and skills that are required to search for evidence, appraise it, and then use this information to address problems and injuries. Let's look at an example within sport. Someone coming in with a knee injury, for example. They'll point to the knee, they'll probably describe some functional challenges. They might have difficulty getting to and from the shops. They might be sore running. It might be that they're getting up off a chair, or if they're in the gym, it might be when they're squatting with weight. Either way, an athlete might come and see us with knee pain. At this point, we're probably going to use either paper and pencil, or we'll use something on the computer to record what's going on in a conversation with the athlete, because we want to know. We want to understand what makes them sore, what makes them feel better. We want to understand where the functional discrepancy is, what they're unable to do in their sport, how long it takes before pain comes on, and how long it takes for that pain to go away again. We want to know if there's anything they've tried to make themselves better and what that was. Is it the use of ice? Is it heat? Does rubbing it help? If they put on a strap, does that help themselves? Or do they find if they do a warm-up before they go out and run, for example, does that make it any easier? So we've got a lot of questions to ask. We also want to know their history. Have they had any previous injuries, this area or anywhere else? We want to know about the joints above and below any area that's sore. We want to start building the relationship with the athlete so that we can understand what's exactly bugging them, what's making life difficult for them just now. This might take place with other members of the family present as well, so that we can get a greater understanding to that lifestyle and home situation. Ultimately, though, we're going to move from there into doing some functional tests. We'll set a test up. We'll either demonstrate or we'll instruct how we want the test to be performed. And we'll have an examination, usually one-to-one, but sometimes with a video, and sometimes using the tele-rehab service through the computer. And that allows us to do observation. And we're able to see just how well an athlete is able to participate in these functional tests. And there are myriad tests. There are also tests that we might do if we're involved with the athlete there and then on the bed or the plinth. And there are a number of tests we can do to the knee that give us some information that we want to look at and analyze. And that will give us the potential for a diagnosis. Sometimes these tests will be performed by the athlete themselves. Sometimes we'll need to use our hands to perform the motion. And this gives us an idea of active movements and also passive movements. What can the athlete do themselves? How is it different from when we do it to them? We'll also start to analyze strength, but perhaps we need further investigation. So we may well send them for an investigation that could be a CT scan, could be an X-ray, or like this, an MRI scan. And the scan will come back and show us this black and white image. We usually have someone very highly skilled to understand what it all means, but they can demonstrate what's happening between the thigh bone and the shin bone, where the kneecap is, and any differences in fluid from normal. Perhaps we'll need to look at some strength testing in detail. So we'll use this kind of isokinetic testing as a means of isolating a body part and getting a reading on it. And then we'll want to look at the data that this produces. And this allows us to compare left with right, pre-season with in-season, before injury, after injury. And that allows us to examine exactly what's going on at this moment and how it compares previously and to the other side. We may not have that facility, but we can certainly use other tools. And we've got some tools like this big orange device in the middle there that allows us to record strength in the clinic. We simply attach it to the bottom of the bed, and this allows us to record information that is sent directly to our tablets or our mobile phones. This can also be used for home use, so that the athletes are able to take it away and give us data that we can see and record every day. As I said, it's not merely the objective information around the biological healing or the injury that's important. We also want to have an idea about how the athlete's feeling. And so we can use emojis, or we can use scales that give us information. And these can be regularly put to the patient in forms of questionnaires or on their electronic devices, so that we get regular monitoring. In the professional sports arena, then athletes will be monitored, if not every day, maybe 3 or 4 times in a week. And this will give us ideas about their feelings of fatigue, but also if they're feeling vulnerable, or if they're uncomfortable, sore, or just merely not recovered. As the athlete returns towards their sports, we also want to have a look at their psychological scale. So this was developed in 2009 and still stands the test of time to allow us to examine just how ready an athlete feels about returning to their given sport. And it can be used in the pool, it can be used in the gym, it can be used in the field, or it could be in the track. It simply looks at confidence and how the athlete has felt about concentrating on their sport or their injury, whether they feel confident in their injured body part, and also about their levels of ability to be able to perform in their sports. This number allows us to track how ready they are to return to their sport. And we can do this from very early on in the recovery process. Another example is from the World Health Organization, where we can actually go from honing in on what injury status that there is and how the athlete feels about the injury, to more broadly how they're feeling. So this is a well-being index that allows us to track whether they're feeling in relatively good spirits, whether they feel calm and relaxed, active or vigorous, rested or refreshed, and that if we're giving them enough stimulus on their regular basis. As I say, a knee injury could be 9 months, a head injury could take a long time without knowing when the finish is in sight. So it's important that we stimulate them in a number of ways. And ultimately, it's because an athlete has so much happening to them all the time. This is a chart that I've drawn up for work here in Ireland. The athlete, for me, is always in the center. But what these circles show is the elements that will pull on the athlete's attention. And attention and focus is really important for me, for these athletes to get over their injury, and for us to rehabilitate them properly, and for them to return in a psychological ready state. You might be able to see around the top right there that there's the likes of media, social media, image. All of those affect self-esteem, self-worth as you come down the right-hand side of that chart. Affects them emotionally, affects the wellness, which is why we check it. They've got to wonder about their position within a team, or within their position within the world rankings, the national rankings, or the school rankings, perhaps. And so that affects their career state. We also want to offer an ability for them to feel empowered and responsible for their actions, and to have no regrets. So that bottom section there all is marked around psychology. On the left are all the pools on the athlete from coaches and from the analysis staff, from the medical team, perhaps from the nutritionist. And as we work right up towards the top, we have the 3 Fs, friends, family, and fanatics, who have all got significant draws on the athlete's attention. So communication in the phase of injury is really important. If the athlete feels there's too much distraction and their attention's been drawn too far by many other distracting and competing elements, like you see in the chart here, then this can change their psychobiological state. And that actually affects how well they respond to treatment, rehabilitation, and ultimately their return to injury, from injury. So that gives you a little bit of an insight there into the injury state and how we might start measuring. But then we've got a number of approaches that we might use our skills with to help the athlete. So the approaches I've listed there might be manual in terms of manipulation, maybe massage, soft tissue, mobilization techniques. We'll certainly be looking at exercise and movement. There'll be resisted exercise for strengthening. We'll look at functional activities. How do they get back to their sport? We look at hydrotherapy, electrotherapeutic modalities potentially, and then other kindred approaches such as acupuncture, dry needling, or injection therapies. So if we look again, maybe one or two of the areas that you might have thought, what does a physio do in sport? Well, is it injury prevention? Well, this physio here, I'll just mute that. This physio here, for example, might actually have the finger pointed at them. If you watch the athlete running, that's a physio sliding in and makes the tackle with their legs. Oh, sorry, just gone back too far. Can this injury be prevented? Watch the elbow. Watch it again. Can this injury be prevented? Absolutely horrific injury at the Rio Olympics in the weightlifting from an Armenian athlete. This was also in Rio. I'm going to spare you the video there, but he fractured fibula and tibia when he landed from a vault. Spectators said they could hear the sound of his bone breaking. But he did make a return. But was that an injury we could anticipate and really make a difference to? So what about treatment? Well, this is a very old form of treatment that I was actually taught 30 years ago. And certain features of this might still occur today. However, there are other methods that we use now, including the use of elastic bands all across the body in different strengths and sizes. We'll certainly have hands-on, whether that's going to be soft tissue, whether we're feeling the joints and the bones of the body, or whether we're just encouraging some change in the way that we actually perceive what's happening to our bodies by the use of our hands and someone else. And that's very powerful. We may also have to advise and discourage some self-treatments. Foam rolling has become a really major event and industry, and it's very difficult to go to a track and field meeting without seeing a forest of foam rollers sitting upright. However, we have problems now in that athletes think they're doing themselves only good by rolling themselves out in these, when it can actually be rolling out an area that's tight, that it would be more informative if we as physios and medical professionals knew why it was tight. And actually, we're seeing some injuries resulting after athletes have been using foam rollers and the likes of Theraguns. We also do taping and support. So we will face an array of different venues where we might look to tape, and we'll have a variety of tape around. We, of course, also have to fix the boxes that carry our tape from venue to venue. We may find ourselves ultimately just operating off small tables. But we've got a variety of different means that we can strap these athletes, whether it's very elastic or whether it's using the likes of kinesio tape, which has got a different method of actually encouraging movement, but with no support. This is a very rigid form of support and isn't taping, but uses brand new polymer beads. When these are heated, you can mold them around the small joints of the toes or the thumb, the fingers, and then chill straight down rapidly, and it creates a rigid structure that prevents joint movement, and these can be strapped into place to allow training and playing to take place. I mentioned hydrotherapy. We use water in a great number of ways. On the right-hand side, we can use those pools for a contrast of hot and cold, but we can also use buoyancy to allow an increased range of motion where movement is reduced. And we can also allow We can also try and encourage the use of water, perhaps for recovery. And that's what you see, whether it's in the baths that are within a stadium at the bottom here, or whether it's in baths or bins that are used locally when teams go out on the road or at track and field events after long distance running. Okay, rehabilitation. Well, we might do some running, where we'll encourage a 3-point stance and a 3-point start. Here, through neck injury, we're actually giving some sustained holds and getting the athlete to move around in a crawl shape. In this instance, we're looking to recover from lower limb injury, and we're looking to establish balance and coordination as part of running drill. In terms of calf and Achilles rehab, then it's important that we drag heavy weights, and this is an exercise where we use poles in an Arctic drag manner to try and encourage movement and strengthening throughout that entire rear chain. And here, we're looking at encouraging a Swiss ball smash against a wall with good force in a very stable position and a good body shape. So rehabilitation is something that we need to design. We need to design the drills, and we need to understand what the drills might do in a functional sense for an athlete. So we need to know the sport, know the positions. Additional training and education is super important too. It's not enough just to understand what we learn at university is all important. We need to continue developing, because it's a developing profession, which is exciting. And I think you've seen some of the ways that we measure outcomes, both physically and psychologically. And it's important that we rank those and we understand what is best practice and what's useful. And we're seeing a shift in environment. We're seeing more work done for athletes at home, and sometimes through the tele-rehab. We're doing more visits to home and seeing them in their own environments. We've got athletes who work in their own gyms and athletes who work in our gyms. So it's important to understand what we can do and what are the constraints to managing those. And of course, we may well have them in our own physio environments where we can set tasks according to the space that we've created ourselves. As a developing profession, we can see that there's a greater access to more expertise. And I hope you'll see this through your journey as physios. There'll be greater collaboration, opportunity for mentors, strong leadership, and understanding of leadership and mastery of your own environments and skills. There'll be exciting projects, organizations that you can join and be active in to help develop your own sports physiotherapy interest. Certainly the way I develop mine. And there's opportunity for consultations with like-minded people. That education can be formal or informal. And certainly, the internet growth and accessibility allows for so much online free content now that you can have so much informal growth via that form of learning. The use of online apps such as Clubhouse, reading blogs, looking at paid content, for example, by joining certain organizations or watching paid webinars or study days, looking at courses face-to-face and online, and also symposia. Those will be themed events. And there's more opportunity now than when I was young for cooperation and collaboration. And that can be through the social media of LinkedIn, Twitter, looking at networking opportunities with other like-minded professionals and teams, but it could also be through the military. Tactical athletes, for example, as they're known. And there's a lot to learn from that cohort of people. And there's educational visit opportunities. So what about the future for sports physiotherapy? Well, as I've tried to describe, there's a real opportunity for communication, cooperation with other professionals, as well as organizations, agencies, and professional associations, all across mutual interest. And for us, for me, That's obviously sports physiotherapy or healthcare for the physically active, because it doesn't just end when people retire. At the end of their professional careers, we have recreational athletes and weekend warriors to attend to too. The growth of ultramarathons and running, as well as Tough Mudder events and those kind of things, mean that we've got to be on the ball when athletes of any description come through our door. The International Federation of Sports Physical Therapy is really important to us. It's a worldwide federation and represents all the national sports physical therapy organizations. And it's such a good resource internationally for sports physical therapists to promote the profession and to get greater understanding, and also help with education of themselves and of others. There's a World Congress held every few years, and next year this will be held in Denmark, and I'm hopeful of participating and presenting there too. The objectives include promotion of sports physical therapy worldwide, which is one reason why I'm telling you about this today, but also advancing professional interest and stature of sports physical therapy. We want to improve the quality. We want to improve knowledge, skills, and also responsibilities of physical therapists who are involved in sports. It facilitates efforts to conduct research, which is super helpful, and also allows us then to have knowledge transfer. And it encourages communication and exchange by various routes, informal as well as formal. One of the ways that this is done is through the competencies and standards. These have been designed to be demonstrated ultimately at a master's level. They were established in 2000, and I went through a project last year in trying to match them with modern contemporary standards. And they still stand up to be excellent standards for us to try and aspire to and maintain. And they allow us to examine injury prevention, acute intervention, rehab, performance enhancement, safe and active lifestyles, lifelong learnings, professionalism and management, research involvement, dissemination of best practice, the extending practice through innovation, and finally, the promotion of fair play and anti-doping practice. For any sports physio or physical therapist with an interest in sports and healthcare of the physically active, the IFSPT standards document gives us something to really get hold of and understand that we can reflect on what we do and how it stands up to those standards internationally. So I want you to enjoy your journey. I've loved mine. It's been a pleasure speaking to you today. And at the end of the day, people won't remember what you said or did, but they'll remember how you made them feel. And as a physio, that is super important. And perhaps when the Olympics and the Paralympics come to Australia 2032, there'll be some people on this call who will felt that they want to be a physio at some point in their lives, and they'll want to be a sports physio involved in something like the Olympic Games. We might meet in Brisbane 2032. Let's make it a date. Thanks very much for listening. And I'm obviously available for any sort of questions at the moment and in future.
Thank you so much, Steve. Actually, it has been a wonderful session. I think you have covered all of those domains because we have a good set of questions. So I think we can jump right into it with the Q&A session.
Sure.
Yeah, just a sec. So the first question would be, you're associated with the Ireland rugby team for so long, the rugby sport, in fact. So can you just tell us some of the common injuries in the rugby sport that you have come across, sir?
Rugby is a collision sport, and collision sports by their very nature mean that we have blunt trauma on a regular basis. So blunt trauma means that there's an impact of one bony part of a player on another. And occasionally it can be with equipment, such as, for example, the rugby posts or the corner flags. So whenever there's blunt trauma and you get a combination of limb on post or human on human, then there'll be an area of swelling develop almost immediately as you get a bleed within the tissue. If you break the skin, that'll be really obvious and visible, and we'll need to try and pack that and stop the bleeding. But if it's not visible, it's likely that the muscles, which are contained in bags, essentially start to bleed from within, and they get to be very high pressure within the muscle. So they're really important injuries to watch for, that they don't develop and become worse over the course of several days. It's also possible that if you get repeated blows to the same area, you can actually develop essentially a piece of bone within the muscle that grows too. Now that's a little bit more rare, but the actual contusion, this hematoma, this blunt injury to the thigh, to the forearm or the arm, or towards the upper thigh into the groin, these are the most common areas for these kind of injuries. And players will often call them dead legs, cork thighs, corkies, or hematomas. So they'd be very significant. That would be the blunt trauma. We would also see injuries in the gym. So that would be overuse injuries, potentially either in the track or in the gym, where they've done too many reps for their abilities, or they've tried to lift too heavy. Not necessarily like the Armenian weightlifter there, but just enough that they feel more of a strain across perhaps across some of the muscles, or a sprain across one of the joints. So we have to monitor what we're doing in the gym, sets and reps, and we have to look at our dosages. We also see injuries across the tendons, and tendon injuries are very, very common when players come back from a period of either holiday or of not playing, because tendons love movement. They want action. They need activity. So when you have a period of stasis where you're not doing much on holiday, then the tendon itself can respond fairly negatively. And that's when people get achy, perhaps overnight, first thing in the morning. They usually respond well to warming up, but we need to set them some specific tasks and goals to encourage a bit more strengthening there. And also there's more traumatic brain injury now in rugby, but probably less than it was a few years ago, because the game is trying to be more safe, because there's an understanding that the brain essentially is like an egg. And whilst we don't often crack the outside of the egg or the skull, we do shake the inside yolk frequently. And at the moment, we're just beginning to understand how that affects our vision, how it affects our comprehension of simple tasks, how it affects our balance. And all of these might be affected much longer for one person than for the next. So I think with all injuries, we're now also beginning to understand, whilst we can compartmentalize what an injury might be, maybe a diagnosis, the way an individual responds to an injury and their rehabilitation can be very different to the next individual. So we have to individualize all treatments.
Thank you, sir. So the next question is what is basically, as you said, the contact sports. So what will be the role of a sports physiotherapist on the field? And how is the decision-making process, which is a shared process? It will be interdisciplinary. So what do those conversations feel like? Can you just cite one of the conversations which you might have come across? How is the decision made to what is to be done when an injury is faced by a sportsman on field?
Yeah, well, I hope I'll be able to come back and do a lecture, a presentation again, where I've actually got a microphone on and I'm wearing a camera. And so you actually see me running on the field of play. So you can see the incident happening in video. And then we've actually cut it and edited it, so you can actually see me running in the field. And then you can listen in to the immediate activity that's taking place. Yeah. So you hear the immediate questions that are asked of the player, and then you can see how we immediately decide that we need to deal with it. So if we decide that a player is unable to continue, then we will be wired with a radio to be able to speak to the stands and say that we're needing to remove a player. At the same time, we've made already some coordinated practice with the doctors and with the staff who are in the medical team within the stadium to be able to, what would be termed, package the athlete off the field. So this is where we would want to immobilize. If it's a fracture or if it's a ligament injury, perhaps we need to immobilize that, take the limb in a safe and secure manner onto a stretcher, and then remove. So this is all deemed pre-hospital care, and the first few minutes can be super important for the health of that person. I think anyone who watches football would have seen that with the Ericsson situation in the European Championships. Yeah. The cardiac arrest on the field and in front of 60,000 people, and they manage CPR on the field. So the feeling that CPR should be administered once at least before the player is taken off the field and removed and resuscitated within the confines of the medical space indoors. So an immense amount of planning goes into what might happen in a game. And equally, with the amount of planning that goes into what happens in a game with that sort of emergency situation, we also do a reflection 24 hours after a match to discuss how did we handle every situation that goes on in a game. So that might be between, for us with Ireland, we'll normally look at maybe between 11 and 19 incidents in a game. And we'll examine what we saw from our different positions, 2 physios, 1 doctor. We'll discuss, the 3 of us, what we saw, witnessed, and what we thought was happening at that time. And then we'll discuss the interaction. We'll discuss what was said over the radio. And we'll discuss how the communication affected the removal of the athlete. So planning and reflection affects what goes on the field. So that's probably one thing for us to discuss and consider and think about.
Okay, that's great, sir. So the next question is like, can we predict the injuries that like may happen, or are we prepared for it? Like, and what does the sports physiotherapist do? Like, I think you have covered part that how we can prevent the injuries that has been covered by you. But can we predict any of the injuries that may happen on field while the game is going on?
Well, I showed just a few clips there of videos demonstrating it's probably very difficult to predict any of those type of injuries. And in a sport where there is collision occurring, you can predict there will be blunt force and trauma, so there is likely to be injury. So therefore, the only way that we can reduce that is either by improving your internal mechanisms, so by being strong enough, by having enough muscle tone, and by being prepared physically for the task, or by having a degree of protection. And that's what we showed with some of the strapping and some of like the thumb splint for the base. But you're only allowed to have 10 millimeters of strapping or of splint maximum in the game of rugby. Now that differs from sport to sport. So in American football, for example, in the United States, you can wear any amount of protective wear. So not only do all the team wear pads for their thighs and for their ribs and for their head with a helmet and for their neck, but they can also wear supports for their knees or elbows, which simply are not allowed in most sports because of the risks to the opponents. So it is sport by sport specific as to what you're allowed to actually wear by way of equipment. So it's very, very different. So predicting wise, you can predict from some degree, with some degree of skepticism from some of the papers, because they're based around certain populations. And one of the biggest problems just now for women is that most of the study populations are done on men and male athletes. And as we see more female physios coming through and more women doctors coming in and more female sports scientists coming to the fore, we're quite rightfully saying we need more research on the female athlete, because a woman can deal with injury in a very different way. Equally, they may be injured in a different way to the male athlete. Similarly, populations of age are different. So the younger athlete has got challenges in a very different way to the masters athlete, for example, for whom overuse might be really significant. And therefore, for your likes of your swimmers, your master swimmers simply can't do the same repetitions that your teenage swimmers can do in the pool. So there are different ways that you have to interpret the information, the data. But ultimately, the only way to prevent a sports injury is not to play sport. And actually, we're trying to encourage exercise and we're trying to encourage sport. So that doesn't seem very sensible to me. We just have to mitigate risk. And we have to look at what the risk to benefit is. We have to try and manage risk the best way that we can.
So surprisingly, that was the next question that I was about to ask you. That has sports physiotherapy good scope even for the girls? Like, can they also, become a good sports physiotherapist?
Yeah, very much so. So we have a number of girls and women who are involved in physio here in Ireland, and who are doing some great work in promoting not just women's sport but also men's sport. So it's not a problem in any way of interacting with both genders. And what we're looking to do is try and build up the amount of information we have on female rugby players in particular, because in Ireland that's what we're doing just now in my business. But there's a lot of crossover. So the professional players, the professional athletes will only be allowed to play rugby, apart from perhaps something like golf and running and cycling. They won't be allowed to go skiing, for example, because the risk is too high. But if you're not professional, then you can play any number of sports, because you're not being paid. There's no right for people to stop you. So actually, a lot of the women here are also looking at how female rugby players are affected by the likes of playing female sports. So we have some women-only sports in Ireland. but also how women are affected differently to men from hormonal changes and also childbirth. So looking at when the optimum time for women to return after having given birth to a child is really important. And there's some guidelines just published by 3 female physios in the United Kingdom last year, based on the best time to start running again after childbirth. So there's some really strong, powerful research being generated by female physios who are changing the face of information gathering, who are synthesizing the data and the information that I described earlier on, and who are coming up with guidelines and research information that we can then apply to our women and our females around the world. So yeah, really exciting time to be a woman involved in physio.
Yeah. So would you say, are there any set of, specific physical attributes that needed to be a sports physiotherapist? Like this has to be with you to, become or pursue a sports physiotherapist career?
I don't think there's any real physical attributes that are critical. It's helpful. The Americans talk about education by means of chalk it, talk it, or walk it. So by that they mean if you're going to describe or if you're going to try and show an exercise, then you either need to be able to write it down. You need to write it down as the chalk it. You need to be able to explain it appropriately and clearly, and that is the talk it. And then you also should be able to demonstrate a lot of the exercises that we're giving, and that is the walk it. So I do think that the chalk it, talk it, walk it is not a bad way to think about how do we want to get across to people, because we also know that individuals learn differently. So some people's behavior are best suited towards listening and understanding that way. Other people prefer to see things and they need to read it. And then other folk need to actually see you doing something and then have that feeling that they can do it. So it's really, I think, useful that you've got skills in all 3 of those areas. It's super important, maybe not from a physical sense, but super important that you're able to demonstrate empathy. And by that, I'm thinking that you're able to actually have an idea around what an athlete's going through in significant injury, how it might impact on their family or partner at home, what that might mean to their stage of career. So if they're towards the end of their career and they suffer an injury, then that might be significant because they've had no chance to say goodbye. Equally, you have to be empathetic to the athlete who's very young and with their whole life ahead of them, who suffers a career-ending injury or something catastrophic. So you have to have empathy towards the state of life, the stage of life that your athlete is in. And equally, you have to have that global understanding, that societal understanding around what is the impact that you can have on someone and what's the impact of their injury. So how can you make things better that way? And how do you, and also, I suppose, how can you make things worse? So actually understanding what not to say, what not to do, how not to teach it. I think that's also probably important. So having that cognitive understanding and empathy is really, really important.
Yes, sir. The next question is, how is it that athletes like Cristiano Ronaldo or Lionel Messi do not suffer as many injuries versus their peers? Is it due to their medical teams combined with their extra efforts in training?
Talent will certainly get you so far. And if we actually look into talent, we can probably break that down and say, actually, genetics will take you so far. So there's no question genetics affect athletes in a variety of ways, whether that means they appear to be more prone to injury. And there appears to be certain states of genetic understanding now that soft tissue, for example, connective tissue, can be a little bit more stretchy in some athletes and can be much more rigid in others. Now, that actually the stretchiness might suit athletes in some sports compared to others. So you might have that gymnastic ability to be flexible, having that stretchy connective tissue. Whereas if you're too stretchy in connective tissue, that's not going to be so helpful where we're looking to apply force strongly, like in some of our lifting, some of our strength, where we're looking for us to actually demonstrate good rigidity right through the joints. And perhaps what we saw there with the weightlifter might be partially down to genetics around connective tissue. Equally, repetitive injuries. So we know that the biggest indicator of an injury is going to be a previous injury, particularly to the same area. So what we sometimes see is that the repetitive nature of injury might be down to the genetic predisposition of their tissue. So that's important. We also know that having a traumatic brain injury at some stage is more likely to get you an injury elsewhere in the body afterwards too. So whilst we don't understand the individual nature of the head injury, we also know that one person can actually get a concussive event from a very small force applied to the same area as someone who has a number of serious, significant events and yet has got no symptoms. So genetics probably plays a great part in some of what we're thinking about. But you're also going to see that the likes of Cristiano Ronaldo does a lot of work. He does a lot of strengthening work and a lot of flexibility. And there's no question that exercise, that humans are essentially designed to exercise. We're designed to move. We're designed to run, essentially. And then if you're going to add on top of that some significant exercise programs based around his movement patterns, about the functions that he's needing, the functions Messi's needing. Remember, he was very small. It was suggested that he was stunted in Argentina. And so there was a kind of growth program developed through Barcelona when he came as a young boy. So there's no question that the interdisciplinary team can help these athletes with their longevity. But there are risks that they will suffer injury the same as the next player in their team. But some of that will be genetic, and certainly they're probably mitigating risks. So they're reducing their risk of injury by doing as much as they do in the gym.
Yes. The next question is, what are the challenges that a sports physiotherapist, must be prepared or, they face in the career as a physiotherapist, sports physiotherapist?
Well, if we think about the diagram I showed with the athlete in the middle and all of those competing interests pulling in the athlete's attention, it can be very difficult to get your message across about how severe an injury might be or how important it is to do certain exercises. And we will use the likes of Cristiano Ronaldo to actually demonstrate there is opportunity for longevity in career. Tom Brady, for example, is playing top level in America, aged 44. So we're trying not to put too much of a constraint, a barrier around age. But at the same time, we also have to be the realists. And sometimes you've got athletes for whom their brain is starting to cash checks their body just simply can't manage. So the body is no longer up to the physical demands of the sport, whether it's the physical nature of contact, injury, and collision, or whether they're athletes who are on the track and who are finding it simply harder to manage the training that allows them to do marathons at the same speed that they once did. The sprint events, maybe they're able to throw in the field event. They're able to actually manipulate their body over bars for the likes of high jump. And so therefore they just find that it becomes impossible to match up with the athletes who are currently competing. So we have to be the realists sometimes and demonstrate, look, this is significant. You're in another injury phase, or perhaps when we're trying to aid performance, we're demonstrating we're actually no longer at the able to manage what you need to do in training. So your risks of injury and potentially catastrophic injury are much higher. And this is where you mentioned the shared process. The shared process is shared with family and with the athlete for me, because it's important they're taking some of that responsibility. The coach has to be involved. They're looking at performance. So they have to take some of the responsibility for the decisions. It's not simply a medical decision saying, biologically, she should have healed by now. If she's healed, you can do what you want, because that's simply not appropriate. So it's important that the athletes involved, potentially psychologists involved, and it's important as a challenge for us to bring people around a table collaboratively, to collectively say, okay, this is our state of play now. This is where you've been, this is where you need to get to. What's the reality with this situation? Where are you in your career? How is this going to affect your family? How are you thinking about your injury still? So that's one of the real big challenges there. But equally, designing programs to keep the interest, designing programs now, we've got so much data coming in. We need to design programs that actually fit the data profile. So part of my role here is looking at digital fingerprinting of exercises and drills, so that for a player who's in a certain position, I know what the median, I know what their average week looks like when they're training with us or when they're training with their own team. So I know what their data looks like there, and I know the jump they need to make to come into the national team. So I need to help design programs that get that jump done in rehab, so that when they come in, they're able to start playing and training with us, because the levels with us are that bit different to playing in your club or provincial levels. So it's important that I get a hold of that information and start to understand, interpret and analyze data, which was nothing I was doing when I was a physio or started out in sport. And equally, you're making judgment calls. You're having to use everything that you've learned, all of your previous experiences. If you come in with an injury to me today, I've got to start thinking, where have I seen this injury before? What did it look like? What were the signs? What were the symptoms? How then did that respond? And what did it respond well to? What did it respond poorly to? How long did it take? How long has it taken on average for people like you? How long does it take for people that I've treated? How long has it taken for people who've got psychological barriers? What about pain? What's their exposure to pain been in the past? Are they in chronic pain, or is this their first episode? How young are they? How old are they? How experienced are they? How much training have they done? So there's a lot of that information coming in. So when we're visiting, when you come to see me for the first time as a patient, I've got a lot of information to try and drag from you, but I've also got to try and my memory banks and everything I've read, seen, and I've done in the past.
Okay, sir. I think we're running out of time, so we'll take one last question. That is, how do we pursue, like after the bachelor's degree in physiotherapy, how do we pursue a career in sports physiotherapy? Can we jump right into it, or do we need to do a course before that, maybe masters or something like that? And can you shed some light on the scope in India as well as abroad? What would be the difference that we would experience in both settings?
Well, I think we're within our organisation here within the UK and Ireland, we try and encourage people who've got an interest in sport to make sure that they get some foundation level understanding of humans and human conditions first. So we don't discourage them from going into hospitals and working in clinics. And that's got a number of different benefits, we believe, for people who want to work in sport. It allows you to meet so many different people, and it gives you a diversity that you don't get if you go straight to sport. So you start to understand human in a different way. You start to interact with other professionals, perhaps people that you don't have in common with, but you need to work with to try and help a person in the respiratory care ward, the intensive care department, perhaps someone who's had an amputation and you're having to work with amputees for the first time. That might set you up for a career in parasport. You may also want to work in the neurology or the neuroscience departments, working with people who've had strokes or neurological conditions, because that can give you an understanding of how plastic the brain is. By plastic, I mean the brain responds and adapts to situations and environments. So by getting that feel and understanding of what's happening grossly with people who've had some real significant damage, injury or trauma, then you can then bring that across. And a lot of the work that I learned 20, 30 years ago in hospitals in these areas, I still refer to now, and I still communicate with physios in those areas to say, what's new in brain health? Because we're looking at how the brain operates, because the brain perceives what's about to happen. So it's really useful to work with an area whereby the brain doesn't perceive quite so well. Maybe we need to learn a little bit more about balance coordination. But certainly a lot of that is just about working with people and working with people from other areas. So I don't see that that would be much different working in India than it would be across Europe. There's good opportunity to start your journey of learning about how to work with people. But at the same time, there's opportunities to work in some of the areas in sports, perhaps that don't have the same level of professional expertise like those at my area are now 30 years on. So there's opportunities to work for local teams, local clubs, maybe offering yourself as a volunteer for multi-sport events, maybe at universities. I started at a university sports club. That was the first injury clinic I did. And I would go there twice a week. And I would see any of the university students who had been injured over the week. And we would just manage them. But that allows you to start, again, building up your repertoire of skills, getting a greater understanding of how you do assessment and what your management of conditions are. And it gives you opportunity to have a better feel for certain limbs, gives you a chance to feel different people's weight, different people's ankles, what they are around the knees, how do they move, how do they function, how is it possible they can do that with their shoulders? And then also being able to put some of what you've read, what you've seen, some of the blogs, perhaps some of your YouTube, some of the Instagram, some of these kind of opportunities, you can then say, okay, does this work? maybe I start attending the courses. I'm not saying do a master's straight away. I'd advocate not doing a master's straight away. I say build your experience first, get some exposure in different areas, and then get your master's. I was 14, 15 years before I started my master's. So in sports, because I wanted to have that ability to understand people a bit more, and I needed to have exposure in different areas. So by the time I came to the master's program, not only was I able to learn myself, I was able to give more of me to the program. So I was able to help more people who were in the group. I had more experiences and exposures to certain conditions I was able to bring to certain sessions. And I think I got so much more out of the master's there than by simply bolting it on to finishing your degree. So I'd say it's those sort of areas, wherever you are, and then using the likes of, if you're interested in sport, getting involved in looking at, can India become part of that International Federation of Sports Physical Therapy? Look at the competencies that are involved there, and then look at, right, I want to have those standards. I aspire to being a really good sports physio. What do I need? I've got those different levels, those different standards that I should aspire to that will give me leadership, mastery, skills, communication, all of those areas, in addition to the sort of manipulation, massage. I have soft skills as well as I'll have those physical skills. And when I put them together with what I'm learning through those competencies, you know what? I'm going to be a much better person dealing person to person. And remember, the person who's opposite you happens to be a human who just happens to be involved in sport at that time of their lives. They're still just a human. So I think the more exposure to humans, the better, and great if it's diverse. A great profession to be in.
Thank you so much, sir. I think we're really out of time. So definitely we have to plan another session, because this one was really inspiring. I know I am. So I would definitely ask ma'am maybe to conduct another webinar regarding the same topic, and we can go into details maybe regarding the conversations, the situations what the sports physiotherapist faces on field, off field, and we could discuss much more. So I would like to thank our speaker, Mr. Stephen Mutch, once again, for giving us such an insightful meaning to understand the role of a physiotherapist in the field of sports. I'm sure our young listeners are enlightened in a new direction about the scope of physiotherapy as a sports physiotherapist. I would like to thank my colleagues and GITAM family for their support and participation. I also thank Dr. Madhuri Kasi ma'am, our director, GITAM School of Physiotherapy, and the whole of GITAM management, who gave the opportunity to organize this webinar. Most importantly, I'd like to thank all the participants who attended this webinar. Thank you all. Also, I would like to remind that the BPT program has started, but yet the admissions are open. If anyone is interested, you can visit our website or contact any of our faculties directly. And if you have any further queries related to today's topic or the admissions, you can always visit and contact us. Thank you so much, Steve. I'm sure we'll be seeing again, and have a wonderful session again soon. Thank you so much. Yeah. Wishing you all the very best. Yeah. Wishing you all the very best, and have a nice evening. Thank you all. Bye, Steve.
Bye-bye.